The Zika virus has claimed few lives so far, while more than 11,000 people died from Ebola.
We saw Liberians dying every day. And you see people sick. And up to when I talk about it, I think I still shed tears. Because these were horrible experiences that we don't want for Liberians to go back to those days.
Experts don't expect Ebola to ever return with such ferocity.
Right now, in the 3 heavily affected countries of West Africa, there are response systems. I don't think we're going to see anything like the kind of terrible epidemic we saw over the past 2 years.
Those countries now have laboratories, better hospitals, and public health systems. The slow response from donor countries and the World Health Organization enabled Ebola to tear through West Africa. In contrast, the WHO has already called Zika an international emergency because of its link to birth defects. But experts say more needs to be done.
We need to build the systems around the world to find things when they first emerge, to stop them rapidly, and to prevent them whenever that's possible.
Large pharmaceutical companies worked cooperatively to produce Ebola vaccines. These companies say they need to be consulted sooner when a health crisis strikes.
We are necessary. NGOs cannot develop vaccines and manufacture them to the kind of scale that we need.
Drug companies are ready to start working on a Zika vaccine, and experts from the U.S. and other countries are working in Latin America to help find the cause of the virus's alarming link to birth defects. But funding is also critical, not just for Zika or Ebola, but to combat any virus.
Next time, we may not be so fortunate as to have something we can contain. We might have a novel influenza that will literally sweep the world and cause millions of deaths in its wake, and we can't allow that to happen.
VOA will take a closer look at Zika, the international response to its spread, and its connections with birth defects as information unfolds. Carol Pearson, VOA News, Washington.